The diabetic screening programme looks after patients with diabetes in the Sunderland and the South Tyneside area. Once you've been diagnosed, your GP will refer you into this programme, and then we'll look after you to make sure that once a year you have a regular check of your eyes and feet to make sure that everything stays healthy at the back of your eyes and within your circulation of your feet. Right, hello Eric.
Hello.
My name is Helen, and you're here today because we are going to do your annual diabetic screening check.
Yeah.
And that is the examination of your eyes and your feet to make sure everything's nice
Yeah.
and healthy.
Yeah.
What that will involve is we'll do an eye test first, then I'll put some eye drops in your eyes,
Yeah.
and then we'll take you into the room next door for a foot examination. Is that okay?
Yes.
The first part of your appointment is a very simple eye test, and that's just to tell me how good the level of vision is in your eyes today before we take the photographs. Now the chart that I would use is a simple letters chart. Are you able to read that okay for me? If not, we do have some other charts. We've got pictograms and other letters, but if you feel the manage with that one, then this is the one that we'll use.
Yes.
Right. Now to do this eye test for me, we need to measure the level of vision one eye at a time. So can you cover your right eye for me? That's
Yeah.
perfect. Now what's the top letter?
E,
And can you read any more?
O, E,
Excellent. Can you make any more out, or is that it?
H, L, E,
Excellent.
N, T, C, O, H, L, A, O, T.
That's excellent, Eric. Thank you. Now, what we need to do is measure the level of vision in your other eye. So can you now cover your left eye for me? And we're going to do the same again. That's perfect. Now,
Yeah.
starting at the top,
Yeah.
can you read that letter again for me?
E,
And the next ones?
O, E.
Okay, Eric, that's the test finished. You can put your hand down now. Now, that test shows me that you've got a very good level of vision in both of your eyes. What I'll do is I'll record that information into my computer system, and I'll compare how well you read that chart for me last year, just to make sure that there's been no changes and your vision is still good. Is that all clear for you, Eric?
That's clear.
The next part of your appointment is for me to put some eye drops in your eyes. Now these eye drops are simply going to dilate your pupil, and that just means the black bit in the middle of your eye will be enlarged, which will allow me to see through to the detail at the back of your eye.
When you put the drops in, will it hurt?
No, Eric, it won't hurt, but you will feel a sting, a little bit like if you've got some soap in your eye. It will blur your vision for a little while, but that will wear off after you've left the department, usually about 3 to 4 hours. Do you understand what I've told you, Eric, and are you happy for me to put these eye
Yeah.
drops in your eyes?
Yes, I'm happy to put the drops in my eyes.
Okay, before I do that, I'll just need to wash my hands to make sure they're nice and clean. Right, so these are the eye drops, Eric. Now, they will make your vision a little bit hazy when I've put them in, so when you go outside today, if it's a bright sunny day, just be careful how you cross the roads, okay? Tilt your head, look up at the ceiling there for me. And that's one eye. And that's your other eye. Does that feel okay? Right,
Yeah.
I'll get you a tissue. So it just makes your eye water a little bit. Just
Yeah.
dab your eyes with that tissue. Does that feel okay?
Yeah.
If you feel a little sting, it'll wear off very, very quickly. Okay? And that's us finished in this room now. That's everything done.
Yeah.
Okay.
So hi Eric, my name's Laura and I'm one of the foot screeners. So this part of your examination, basically all I'm going to do is just check the feeling in the bottom of your feet.
Yeah.
Okay. Are you happy for me to go ahead and do that?
Yeah.
Yeah, lovely. I'm just going to check the amount of blood that's flowing to your feet. So first of all, I'm just going to touch behind your ankle bone.
Yeah.
And behind here I can feel the blood pumping around, so that's a good sign. I also just need to check the top as well. Yeah, nice strong pulses there, so that's good. So I know that the blood's flowing a good amount flowing around your feet. Okay.
Yeah.
If for any reason I couldn't feel anything, we can use this machine, and this would be able for both of us to be able to hear the blood flowing around. Okay, but everything was fine, so we don't need to do that today. Okay. So the next part of the test, I'm going to just check your feet to see what feeling you've got there. Now, to do this, I'm going to use this little piece of nylon wire. It's not a needle and it doesn't hurt, it's just a gentle touch on the bottom of your feet. Okay. So would you like to have a little feel on the back of your hand, just so you know that it doesn't hurt? So this part is where I'm gonna test the feeling in the bottom of your feet. All I need you to do is close your eyes for me and just say yes every time you feel me touch your feet. Okay.
Yeah. 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 Yeah.
So everything's fine there. The last part of the test, it's a similar sort of thing, just to check the feeling. I'm going to show you on my arm first. Doesn't hurt. You should just feel a little buzzing feeling. If you'd like to put your hand out for me and just let you know, so you know what to expect. So I'm just going to put this on the end of your toe. If you can tell me if you can feel a vibration.
I can feel a little buzz.
So that's the end of the examination, Eric. Everything was fine, but I've just got a few questions to ask before you go on to the final bit of your appointment. So, have you ever had any nasty wounds or anything on your feet?
No.
No. Do you ever get any cramp in the back of your legs?
No.
And do you smoke?
No.
So that's the end of your foot examination. Everything's fine. I've got this little information leaflet here just for you to take, and you can take it home and read it with the staff, just to make sure that you're doing everything right.
Yeah.
So you just need to pop your socks and shoes on now, and I'm going to take you through to the other member of staff to get your eyes photographed.
Okay.
Eric's ready for it.
Hi Eric, do you want to come in and take a seat for me? Okay Eric, would you like to take a seat here for me? Get nice and comfy. That's it, and we'll turn you around. That's perfect, thank you. Okay Eric, this is the last part of your appointment today, and this is where we're actually going to take the photographs of the back of your eye. Now what we're going to do is we're going to photograph through the front, but I'm actually concerned with your retina, which is the part at the back of your eye. When you have diabetes, your blood has more sugar in it, and that can make it a bit more sticky. As the blood flows across the back of your eye, it can sometimes block some of the tiny blood vessels at the back of your eye, and that's where you can run into problems. So we're going to take 2 photographs today, 2 on your right eye and 2 on your left eye, and then we can have a look at them together on the computer and see what they tell us. So do you understand what I've just told you, Eric?
Photos of this eye and photos of this eye.
That's right. Okay, Eric, to take your photographs, we need to get you nice and comfortable. What you need to do for me is lean forward so your chin rests on that part and the top of your head is gently touching that part. Can you do that for me? That's perfect, and just hold it right there, don't move. So we're going to take the photographs, and when I take the picture there will be a bright flash. Nothing will touch your eyes, and I need you to look in the direction of the little flashing green square that's inside my camera. That will get your eye lined up in the place that I need it for the photograph. Okay? Just follow the little green light across the screen for me, Eric. Well done. Nice and wide with your eye there. That's it. Nice and steady. I'm going to take your picture now. Thank you. Okay, Eric, if you'd like to sit back for me. That's your photography finished for the afternoon and the end of your screening visit. Your photographs that we've taken this afternoon will be looked at just to make sure that all the blood flow is nice and healthy at the back of your eyes and there's no blood vessels that are blocked or leaking that might cause you a problem. When they've been looked at, we'll send a letter out to you in the post and we'll write to your doctor as well so they know that you've been screened, and then we'll simply send for you again in 1 year's time and repeat the examination then. Is everything okay for you?
Yes, thank you.
Okay, Eric. I'm going to give you some information now. That leaflet is just a contact leaflet. If you have any problems following your appointment today, any discomfort in your eyes or the haziness is a problem for you, there's contact details on there where you can get some advice over the phone. And then that's the leaflet all about the screening service that you visited this afternoon. If you have any more questions, our contact details are on there, so you're welcome to give us a ring and we'll happily have another chat with you over the phone. Okay? Thank you very much for coming today. It was nice to meet you. Thank you.
Thank you.
Bye-bye.
Is everybody here? Can we start the meeting now?
Yes.
Has everybody got their agendas?
Yes, we have.
That's good.
Okay, are you okay, Howard? What you drinking there a lot?
I'm right, but I need to do.
It's all that tea you drink.
I'm always thirsty.
Come on, guys. We need to get started.
Yes.
Okay.
Oh, hang on, I need to do.
He's always on the loo.
I think it's time, you guys. We had a vote.
Yes.
Wake up.
You should go and see a doctor.
You're always thirsty.
And you always go to the loo.
Now you're always falling asleep.
Well, Dr. Dowsett, come in, have a seat. So how's things? Good, good. We've got the results back from the lab, from the hospital, and they show that your blood sugar is a bit high. So this means that you've got diabetes.
And what does that mean?
That's a good question. It means that your blood sugar, the sugar in your blood, is high, and that can damage your blood vessels. And that in turn can damage your eyes and your feet. So if we can control your blood sugar as best we can, then it's less likely to cause damage to your eyes and your feet. And we want to keep you as healthy as long as possible. Do you understand what I've been saying to you?
Yes, my blood sugar's high.
And we need to control that as best we can. There's two different types of diabetes. There's type 1, where you need injections, that's insulin, and there's type 2 that you've got.
What is type 2?
Type 2 we should be able to control with diet, but we may need to add in tablets later on. So that's why diet is so important, to try and keep your blood sugar down so we don't damage your blood vessels and we don't damage your eyes or your feet.
What kind of things I can eat?
That's a very good question. What the things to avoid are things like sugary things and fatty foods. But what I'll do now is to hand you over to the nurse so she can go through it with you and explain to you in more detail what you should avoid and what you can eat. So have you got your health record with you, Howard?
I have, yes.
Oh, that's great, that's good. It's all filled in well, great. So what I think we'll do is we'll go through to the nurse so she can update this and she can go through your diet again with you, so that you know what things you can eat and what things to avoid.
Yeah.
So is that okay? You're happy with that? That's great, right, well done. Right, I'll just take you through then.
Howard, because you have diabetes, it's really important that we're careful with the kind of foods that you eat. We need to avoid foods that are very high in sugar, and we need to try and eat more foods that are lower in fat and that are healthier for you. It's important that we try not to eat too many foods that are high in sugar. These could be sugary drinks, fizzy drinks, cakes, pastries and biscuits, jams, marmalades, honeys, and puddings.
And I still have ice cream.
Well, what I'm going to do next, Howard, is I'm going to book you an appointment with the dietitian. Now, this is a person who can tell you more about the foods that you can eat and perhaps more about the foods that you shouldn't eat too much of.
Okay.
I will also need to arrange for you to have an appointment to have your eyes checked and your feet checked. And what we're going to have to do from now on, Howard, is keep a really close eye on your blood sugar levels.
How often do you have to come back?
Well, we'll probably see you every 3 months at first, and then if things are going well, maybe we could just see you every 6 months, but we will be keeping a close eye on your blood test results. Do you understand everything I've been saying to you, Howard?
Yes.
Okay, that's great. These are a few leaflets. If you want to take them home with you, perhaps your support staff could go through them with you at home. You will find some information about Desmond in these leaflets. Desmond stands for Diabetes Education and Self-Management for Ongoing and Newly Diagnosed. More simply, it's a way of finding out more about type 2 diabetes. It's a resource to help you manage the changes diabetes will bring to your life.
It's an opportunity to meet and share experiences with others. You'll be referred to the Desmond programme to find out more about type 2 diabetes. Is that okay? That's us done, Howard, now, okay?
The subject of consent to procedures and operations is a very important one. No one can consent on behalf of an adult. The Mental Capacity Act 2005 makes the presumption that an adult can consent for themselves unless it is proved otherwise. Many people with learning disabilities do have capacity to consent, but if a person has a learning disability, they may not be able to consent.
Hello Paul, I'm Rosemary, I'm your nurse today and I'm going to take your blood. Can you tell me why you're here today?
Yes, because I need me iron checked.
Can you tell me what happens if you don't have your iron checked?
I get so tired and weak.
So you're happy to have your blood test today?
Yes.
And are you going to give me consent to do it?
Yes.
The decision maker must decide if the person has capacity to consent. The decision maker is always the person doing the procedure or operation. In healthcare, this is often a doctor or a nurse, but it could be anyone else involved in the person's care. The doctor or nurse needs to find out if the patient can remember information about the procedure. The patient needs to think about the good and bad things about having the procedure and weigh that up to make a decision about whether they consent to the procedure.
Can you tell me what consent means?
It means that I can let you do it.
That's great. Shall we get started?
Yes, please.
Could you hold your sleeve up for me?
I will.
I'm just going to wipe my hands. Is that all right?
Yeah, that's fine.
Now I'll put my gloves on. I'm going to put your tourniquet on. It will get tight. Could you put my hand for me? Make the vein rise up. Brilliant. Right, make a tight fist for me so I can feel the vein. Right, I'm just going to make the skin nice and clean before the needle goes in. Right, we've cleaned it and we've got a nice vein, so I'm going to put the needle in now. Can you understand what I've just told you?
Yes.
Can you repeat it back to me?
Yes. You say that you're going to put the needle in my vein and to take some blood out.
That's good. Shall we do it then?
Yes, please.
If the decision maker decides the patient can't consent to the procedure, the decision maker has to make a best interest decision.
Hello nurse, this is Stevie and I'm his mum.
Hey Stevie, I'm Rosemary. I'm here today to take your blood. We're going to take your blood to treat epilepsy medication because if we don't get it right you can feel unwell and you could have more fits.
Okay, then let's get your sleeve up ready for the needle. Come on.
Before we go any further we need to discuss whether Stevie can give consent.
Oh, I can do that because Stephen can't talk and he can't write anything down.
But under the law no one can give consent for another adult.
I don't see why not. I've always done it before.
Would Stevie be able to understand the good and bad things about having his blood taken?
No, I don't think he would, no. So what do we do now?
Stevie, if you can't give consent, then we're going to have to look at a best interest decision.
When the decision maker makes a best interest decision, they have to think through the good and bad things about the procedure. They also have to consult with family carers, staff members, and anyone else involved in the patient's care. The more complicated the decision is, the more people the decision maker will involve.
When we're making a best interest decision, we need to look at the good things and the bad things when we have the blood taken. The good things about doing the procedure today is that Stevie's seizures would be controlled, his medication would be right and he would remain well. The bad things about Stevie not having the procedure would be that his fits could increase, it could affect his liver and he could have an admission to hospital. Are you in agreement that the procedure should go ahead today?
Oh yes, I think it's a good idea.
The decision maker then has to make a decision and fill in a form. It's important to remember that the decision is up to the person doing the procedure and not anyone else.
Well, I'll sign the form and then we'll do the procedure.
Remember, giving consent is up to you. It is important that you're given time to make a decision. If you want to know more, there is information on the internet under Consent or the Mental Capacity Act. Your GP or people in your local learning disability team will also be able to tell you more about this subject.
looks nice. What's the matter, Rochelle? Are you not hungry?
No, I've got toothache.
Didn't you just get a reminder to visit the dentist?
Yeah, but I chucked it in the bin. I hate going to the dentist.
Yeah, typical.
Oh, well, you have to get that seen too. I would like if I come with you.
Would you?
Of course I would.
Hello there.
Hi, my friend's got a sore tooth, but she's a bit nervous seeing the dentist.
Well, why don't we all take a seat and have a little chat about it? My name's Lisa and I'm the receptionist, and this is where we welcome people into the surgery and log them onto our computer. Frank was saying you're a bit nervous, is that right?
A bit, yeah.
Well, try not to worry. We're here to solve any problem that you might have. How long has it been bothering you?
A few days. It hurts a lot.
Well, we better do something about that. Will you come over to the desk with me while I log you in?
Can my friend come with me?
Of course.
Rochelle, would you like to come through with me?
It'd be alright, come on.
Right, Frank, would you like to take a seat over there? Rochelle, if I can take your code for you there.
Hi Rochelle, lovely to meet you today. I'm Mark, I'm the dentist. Would you like to take a seat in the dental chair for me?
Rochelle's a little bit nervous, so I've explained we're just going to take everything nice and slow.
That's great, we'll just explain everything before we do it, Rochelle. We're going to do an examination of your mouth to see if we can help you. Would that be okay?
I'm just going to pop a little apron on, okay, just so we'll get nothing on your top. Would you like to pop these glasses on, just so we'll get nothing in your eyes?
Okay, we're just going to tip you back now to have a better look inside of your mouth. Would that be okay? Okay, we're going to have a little look inside of your mouth now. We've got a light here which we're going to put onto your face, and I've got a very small mirror. Just going to have a look around all your teeth. There we go. Are you comfortable? I'm going to start the examination now. It shouldn't take very long, no more than 5 minutes. When we're busy, you'll hear me saying some strange words you mightn't understand to Faye. It's just me telling Faye what's in your mouth at the moment. I understand you've got a sore tooth there today. Could you let me know where that is, please? Okay, that's great. What I'm going to do, I'm just going to get my little mirror and have a little look inside of your mouth, see what we can see. Okay, let's open your mouth really wide for me there. That's great. Wonderful. That's great, thanks for that. For this, I'm going to have to dry your teeth so I can get a better look. Have you had someone use the air in your mouth before? You can just give me your hand there. I'm going to blow a little bit of air on you. This is what it's going to feel like. How does that feel? Does that feel okay? Okay, can I have a little look inside there now? Just to blow some air in. That's good. I'm going to blow some air onto your teeth. You just get them nice and dry so I can have a better look. Okay, here we go, Rochelle. That's great, thank you very much, Rochelle. That's everything done with the examination now. We just need to sit you forward. Here we go. Right, okay Okay, there's definitely something going on with that tooth. I do need to get a bit better look of it though, so what we need to do is just take an x-ray. So just like to come down the corridor with me and we'll get that done for you.
Can my friend come with me?
I'm afraid not. We can only have someone in the room who's getting the x-ray taken, but Frank can sit outside if you'd like. He'll be outside the door. This is our x-ray room, so we take all of the x-ray pictures of your teeth. Before we do anything else, is there any chance at all that you may be pregnant? Okay, the machine we've got here, it'll take an x-ray picture of all of your teeth here. What we're going to be doing is you're going to be standing inside the machine, and as well as taking a picture of your sore tooth, it'll also take a picture of all of your other teeth, just to make sure they're not going to become sore as well. Okay, Rochelle, if you decided to come this way with me, you just want to step around that way and pop yourself into the machine, then face out towards Frank. What the machine's going to do is going to allow us to see right inside of your tooth, okay? If you just pop your chin onto here, okay, and bite between the little notches on the so move your chin forward there and bite together. That's lovely. Right, what's going to happen now is the machine's going to go right around your head, makes lots and lots of noise, it doesn't touch you, and need you to stay really still for a few seconds. Now we need to leave the room now. You're only going to be by yourself for a few moments, would that be okay? Okay, Rochelle?
That was quick.
Yes, it looks as though you've definitely got quite a big hole in your tooth there, which has been causing you the pain that you've been having. So we make sure we clean everything out and then pop a little filling on there, and then the pain should go away. We can do it today if that's okay.
What's going to happen?
Right, what we're going to do, we're going to start off by putting a little bit of gel onto your gum, and that will just make your gum go to sleep. When your gum's all nice and asleep, we'll put a little bit of liquid into your gum, which will make your tooth go to sleep. You don't feel anything, and it's not sore. Okay, Rochelle, what we're going to do now is we're just going to put a little bit of jelly onto your gum and make your gum go to sleep. Okay? I'd like you to open really wide for me there. That's brilliant. And I'm going to put a little bit of jelly by your tooth here. That's lovely. Just stay nice and relaxed, nice and still. That's brilliant. That's good. Let's leave that on for a few seconds. Lovely. Right, that's great. That should be nice and asleep there now. So we're going to just pop a little bit of liquid into your gum with a little injection, okay? But you shouldn't feel anything, just a little bit of cold, okay? Okay, if you open really wide again, and I'm just going to do this now. I feel a little bit cold, but that's it. You're doing wonderful. That's great. Okay, Rochelle, we're just going to have a little check in there now. Make sure the tooth's gone to sleep. Just like to open nice and wide for me. Now, and I want you to let me know, can you feel anything sharp at all there when I'm doing that? Great, that's brilliant. I think your tooth's asleep now. What we need to do, we need to take the bugs out of your tooth, okay? So what we'll do there is I've got a drill to do that. There's lots of water comes out of my drill, okay?
Will it hurt?
No, it won't hurt at all. It'll feel a little bit cold. If you do want me to stop though, just lift your left hand at any time and I'll stop straight away. Okay, we're going to get started now then. What I'm going to do first of all is just show you what the drill sounds like, okay? So here we go. There's lots of noise and water comes out of the end. There you go. Alright, so what we're going to do as well, we're going to have the sucker in your mouth, which is going to suck out all of the water.
So this is the Hoover and this is what sucks the water out of your mouth. If you want to have a little listen, it's quite noisy. If you like to have a little feel on your hand.
That's great there, Rochelle. Everything seems fine. I'm just going to do one final little check and then we'll see if it's ready to get the filling. Okay, that's great. We've just got to pop the filling in there now. Okay, nice one there, Rochelle. Okay, Rochelle, just like to close your mouth together there. How does that feel? Does that feel as if you're biting okay? That's brilliant. Right, that's the filling all finished. I'm going to sit you forward and you can just have a little rinse out and spit into the bowl at the side there. That's great, Rochelle. You're absolutely brilliant today. Is that okay for you? Yeah, good.
You're going to be a bit numb up there, okay? It's going to feel a little bit funny for the next few hours. While it feels like that, you need to be very careful not to bite your lip or not to bite your cheek, and nothing too hot to drink or eat. If you have any problems, all of our contact details are on there. Are you feeling okay? We'll see you very soon for a checkup.
Thank you.
Hi Rochelle, how are you doing? Any problems with your teeth?
No, none.
That's great. Just pop yourself in the chair and we'll have a quick look then.
The dentist has asked me to show you a really good technique for brushing your teeth. This is a 3-sided super brush. If you use it like this, it can help keep your teeth and gums healthy. You can take this toothpaste and your very own super brush home. Do you think that looks easy to do? There's your super brush and some leaflets to take away. Thank you.
You've got to have a tea back.
Anyone for biscuits?
No, I'm looking after me teeth now.